from BSN 2-5, I will be performing fetal heart monitoring using stethoscope. First, identify the correct patient. Next, introduce yourself and state the purpose of the intervention. Hi, I'm Kyla. I'm a student nurse and I will be your nurse for today. I will check for the rate, rhythm, and the presence or absence of accelerations and decelerations of the fetal heartbeat. Next, expose the part to be examined and keeping covers in the other parts. Perform Leopold's maneuver. Second maneuver, umbilical grip. Place the diaphragm of the stethoscope onto the client's abdomen where the fetal back is located. Count the beat in 1 whole minute. Assist client